So if you're having dry eye symptoms, then this is the video for you, because I'm going to go over 7 dry eye treatments at home that your eye doctor probably just didn't have time to talk with you about. Let's take a look. Hey, what's up everyone? This is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes and vision. And if you're new here to the channel and you like learning about the eyes and finding the best vision products, then definitely consider subscribing. Otherwise, today we've got 7 different treatments for dry eyes that you can use at home. Tip number 1 are to use artificial tears throughout the day. That's not just once, like maybe in the morning or once at night, but oftentimes using them maybe 3-4 times throughout the day. I know if you go to see an eye doctor for dry eye disease, almost every single one of them will hand you a sample of artificial tears or some sort of dry eye drop that they could recommend for you. And if they have done that, I definitely recommend trying the eye drop that they selected for you and your type of dry eye disease. Otherwise, the eye drop I often hand out as a sample is Cysteine Complete. I prefer to use Cysteine Complete just because it does cover both aqueous deficient dry eye, that's where people don't produce enough tear or watery component to their tears. And then there's the oil component, which over 80% of all dry eye disease has some form of oil gland deficiency. And the Cysteine Complete also helps with the oil component of the tears. For people that need to use artificial tears more than 3-4 times a day, they're using them 5-6 or maybe every 2 hours, then looking for something that is preservative free is also really important. Preservatives with artificial tears putting onto the eye can basically cause a chemical burn to the surface of the eye. We call that medicamentosa. And it's imagine that you washed your hair too many times throughout the day, like 5-6 times throughout the day with shampoo. You can imagine that's going to scorch and kind of burn your scalp a little bit. Same idea with using artificial tears too many times throughout the day, and they have really hardcore preservatives in them. Thankfully, most brand name artificial tears don't use really harsh preservatives in them anymore, but non-preserved artificial tears or preservative-free tears are still strongly recommended. And because preservative-free drops don't have any preservatives, they can still be used for contact lenses. Oftentimes, preservative-free drops come in a little box like this one, and inside they have these little individual non-preserved capsules. These little vials, they come in a big kind of strip like this. You can tear one off, you tear off the top, and you put the drop in, and then you're supposed to throw this away right after each use. But there is also a new development. A lot of brands are coming out with preservative-free multi-use bottles like this one here from Refresh. What's nice is that you don't have to worry about all the individual vials, but if you do pick up one of these bottles, you do have to push pretty hard before the teardrops actually start coming out. I know there's some people who like the gel drops a little bit more because they tend to stay on the eye longer rather than just evaporate very quickly. I know there's many different brands out there. I personally like Cysteine Nighttime Gel myself just because it feels really good on the eye and it's not too thick. But if you ever do reach for a nighttime ointment, those are extremely thick. It's almost like Vaseline on the eyes, and that will definitely blur your vision. But usually ointments are really helpful for the people who sleep with their eyelids open just a little bit. And it can be helpful for people who sleep with a CPAP machine as well. Now, tip number 2 is one of my personal favorites, and that is doing hot compresses for your eyes. Doing a hot or warm compress for the eyelids, the whole purpose of it is to heat up the oil glands in the eyelids. That allows the oil glands to melt, because a lot of times these oil glands will become inflamed and then the oils become clogged up. It kind of turns solidified into something like butter, and then heating it up will get those oils to melt, and then they run smoother out of the glands and onto the tears, and that prevents the tears from evaporating. Okay, stop. Let me introduce you to Zelda. She's my cute kitty over here, and she just will not leave my office, so she's going to be in the video for the rest of the time. Now, there's many different ways to do warm compresses. There's many different products on the market. I've tried about 30 plus of them probably. One of them that we recommend in our clinic is the Brooder eye mask. These are really convenient because you just put them in the microwave for 20-30 seconds, put them on your face for about 10-15 minutes, feels great and gets those oil glands running. It's also something that I like because you can wash it and keep reusing it. But again, there are many other products on the market. Another one that I'll mention here is from Sterile Eyes from The Eye Doctor. It's from Great Britain, but also works very similar to the Brooder mask. But there are many other brands that work the same way, and I'll include a bunch of links to different ones that I've tried and recommend in the YouTube description below. But there are other types of warm compresses that heat up through different methods. There's ones that you plug into a cell phone charger into your laptop, and those heat up. And there's other ones too too that you can even snap with your fingers, kind of like a warmer that you would use if you were going outside in a cold winter. Those ones are also pretty cool. If you're somebody who likes scientific studies, then the compress from iEcho or Tranquilize, this one seems to have the most research-backed studies about not just the benefit of warm compresses, but of moist heat in the compress, because the moist heat is not just going to heat up the oil glands, but the moisture is going to be trapped on the eye, and that's going to help soothe dryness the best. But again, if you want to check out more details about warm compresses, I do have those links in the description below. You can check those out. In addition to just dry eyes, moist heat compress also helps for blepharitis, which is tip number 3, also managing blepharitis symptoms. If you have never heard of blepharitis before, blepharitis is where the eyelids become red, crusty, inflamed due to skin oils and bacteria that sit on our eyelids. Blepharitis is very similar to having dandruff on the scalp, except that it's more on the eyelashes and eyelids. So to treat that, oftentimes doctors can use medication, but at home you can also use moist heat compresses that help break up the oils that have solidified on the eyelashes. But just like having dandruff of the scalp where you would want to get an anti-dandruff shampoo, there are different cleansers and soaps for the eyelashes specifically. And for that, there's different products and brands out there. This happens to be one of them from AcuSoft. It's like an eyelid cleansing wipe. You simply tear this off and open it, and then you wipe your eyelashes with it. They also do make foaming eyelid cleansers, which are very popular because they are very gentle for the eyelids and safe to use every day. And then there's an eyelid cleaning product called hypochlorous acid. And again, there's many different brands of hypochlorous acid that are out there. I personally have not tested every single one and found one more superior than the other. But again, if you want to look more into hypochlorous acid, I do have some description below, as well as a video going over hypochlorous acid more specifically, again, if you're interested in checking that out. Tip number 4 is that after doing any cleansing for blepharitis and doing a warm compress, also consider doing blinking exercises. You can do these blinking exercises after doing a warm compress. That'll get the oil glands pumping, because the whole process of blinking is what squeezes your oil glands of the eyelids and get them to release those oils. And one of the major issues these days is that everyone seems to be on a computer or a phone or studying really intensely, whether you're looking in a book or perhaps you're just playing a board game with family. You are studying very intensely and we don't blink as often. If you and I were just in conversation, typically our blink rate is around 20 times a minute, but as soon as we start focusing on something up close, our blink rate drops to about 4 times a minute. That's a significant decrease. That means our eyes are more exposed to air and our tears are going to evaporate much quicker. One thing you should be doing is the 20-20-20 rule, where you spend 20 minutes doing your normal activity up close, again, whether you're on your computer or your cell phone, but then after 20 minutes you have to take a break, look 20 feet away, give your eyes a little bit of a rest, and blink your eyes a few times. In addition, you can try something that I've been starting to do, which is whenever there's a commercial on TV or on a podcast, or if I'm in the car and I'm stopped at a red light, I actually call it my red light challenge. When I'm stopped, I forcefully blink my eyes over and over again, trying to encourage my eyelids to blink 100% close all the way, because many people don't close their eyelids 100%. If you're a contact lens wearer like myself, the cornea becomes desensitized over time, and then people often don't blink 100%. They feel like they are, but really their eyelids are only coming down maybe about 70%, and that leaves the bottom 1/3 of their cornea exposed to air and dries out faster. But during this red light challenge of mine, I forcefully blink my eyes over and over and over again until the red light turns green, and then of course I'm driving normally at that time just to be safe. But certainly doing blinking exercises can feel really good to the eyes and get that moisture back to its normal level. Now, tip number 5 is to consider taking an omega-3 supplement. Now, there's a lot of debate over the benefits of omega-3s in different parts of the body. They've strongly been suggested for both neurological benefits, historically heart benefits, but also skin, as well as the retina in the back of the eye. And in terms of omega-3's benefits for dry eyes, there's some studies that are strongly supportive for omega-3s, and there's some that really kind of have cast doubt on the benefits of omega-3 for dry eyes. But the vast majority of dry eye specialists that I know all do still strongly recommend omega-3s as a potential treatment for dry eye disease. Now, I'm not going to go too deep into the science of omega-3s, but the whole idea of omega-3s in medicine is that it reduces the inflammatory load within our body. And with dry eyes specifically, there's a lot of inflammation that occurs, and it kind of adds like adding gasoline to a fire. Not only are the eyes not having enough tears and that they're having a lot of evaporation from oil components, but there's an overall inflammatory cascade that occurs and causes dryness to get worse. And a lot of us are living lives where we eat a lot of processed food, and there's a lot of kind of processed oils like soybean oil that have a lot of omega-6s, and that really promotes inflammation in our body. So omega-3s are supposed to combat the omega-6s. But most studies that show benefits of omega-3s for dry eye symptoms do show that taking the omega-3s for about 2 to 3 months does show not just improvement in symptoms for the patient, but also that symptoms or signs of the dry eye disease do go down, and that's something that eye doctors observe in these studies on patients' eyes. It does often take several months of taking omega-3 supplements to have some sort of a clinical benefit, because those omega-3s have to be incorporated into your whole body. Again, omega-3s is a huge topic. There are many different brands out there. There's only one at the timing of this video right now that is actually a prescription omega-3 that you actually need a prescription to have filled, and that's the only one that's actually regulated by the FDA. When you take any type of vitamin supplement, whether it be vitamins or omega-3s, they're not regulated by the Food and Drug Administration. That means there is no overlooking company or administration that is making sure that that is being made exactly what's on the label of the bottle. So when it comes to omega-3s, again, with other supplements, I do strongly recommend that you look for a company or a product that is third-party tested in both their manufacturing as well as their kind of delivery. So as far as getting an omega-3, it's important to make sure you're getting a high-quality omega-3 and not just looking for the bargain bin type of omegas. If you want to know what brands of omega-3s that I've had success with, I will include a couple of different links to products in the YouTube description below if you want to check those out. I do also want to encourage you that if you're considering taking any supplement at all, again, whether that be vitamins or an omega-3, you do speak with your local physician about using those and how it regards to your personal health. Okay, we've covered a lot before, but here are 2 treatments that oftentimes doctors do not mention during an examination. But first, if you're finding value in this, smash that like button for me. If you're thinking the cat is cute, smash that like button for me. And leave a comment below which part of this video has been your favorite. Is there any sort of treatment that seems to have worked really well for you at home? Or if there's something new that's not mentioned in this video that you've been doing, go ahead and leave that in the comments so it helps the entire community. Otherwise, let's keep going. Tip number 6 is to consider using a humidifier in either the office, the bedroom, or the living room. And that's because the air around us can get very dry, especially if you have the heater running at all. The heater can really dry out the air in your house, and that can cause the eyes to feel really dry and scratchy. Again, a lot of us are not blinking enough when we're sitting in front of a computer all day, so having a humidifier to raise the humidity in the office is going to help soothe those dry eyes and prevent the tears from evaporating so quickly. One special tip I'll include is that if you're using a humidifier, make sure you use distilled water and not just using tap water, as tap water will have different minerals that can be aerolized, and then you can breathe in those minerals, and they can even get trapped in your furnace or air purifier in your home. And our final dry eye treatment at home for you today is also about moisture and humidity, and that's using moisture chambers. Now, the whole idea of using moisture chambers as a treatment for a dry eye is certainly not a new treatment by far, but is often one that's not discussed in clinics. Now, there are several different brands and designs for moisture chambers that are out there, but they're all based around the same concept. They're a type of goggle that wraps around the eyes and holds onto the side of the face, and that seals in the moisture of the eyes and prevents the tears from evaporating as easily. Now, again, there's different brands that are out there. This happens to be just my favorite from the Sienna brand of eyewear for moisture chambers. The Sienna brand makes glasses that look more like regular glasses, except that they have this little side shield that is built with magnets, so it comes on and comes off so you can clean them easily. And they are available to having your prescription lenses put into the glasses. Most of the moisture chambers that are out there, they're kind of like onion goggles labels for cooking to prevent your eyes from burning and stinging when you're cutting onions. They don't allow prescription, where Sienna lenses, you can have regular prescription lenses put in there from your local optical. If your local optical or eye care clinic doesn't have the Sienna brand available, you can order from their website if you're interested. I do have a coupon code for Sienna if you want to check that out, and I'll again include that in the description below as well. I hope these tips help you, but as always, make sure that you do follow up with your local eye care physician to make sure that your eyes are being well taken care of. All right, we made it through all 7 tips. Hopefully your eyes start feeling a lot better here at home. Otherwise, if you'd like to check out more information about different dry eye treatments that are available, not just for at home, but also in your eye clinic, then you can go ahead and check out my full dry eye series up here to the side. Or if you'd like to see more videos from Dr. Eye Health, go ahead and click or tap the screen down over here. Again, this is Dr. Allen here. Thanks so much for watching. Keep an eye on it, and we'll talk to you soon.